this, make sure the victim is lying on her back. Tilt her head back so her chin is pointing up. Lift her chin with one hand and press down on her forehead and pinch her nostrils shut with your other hand. Step 2. Put the flashlight and seal it over the victim's mouth. Blow into her mouth to fill her lungs. Look to see if her chest rises. If the victim is a child, seal your mouth over both her mouth and nose, then blow gently. Step 3. Remove your mouth and take another deep breath. Watch to see if the victim's chest falls. Repeat steps 2 and 3 every 5 seconds for anyone over 9 years of age. Every 3 seconds for everyone 9 years of age or younger. If the victim's chest does not rise or fall, no air is reaching her lungs, try to tilt her head back further so that her tongue does not block her airway. If something appears to be blocking the airway, perform the Holmich maneuver.
To sum up, first, check her pulse, and if she's not breathing, pinch her nose and open her mouth, and then take deep breaths to her mouth, and then do it every 5 seconds.
Go. If you do not feel the pulse, locate the bottom of the sternum. Locate the bottom of her sternum. Place the heel of one hand on the sternum, 2 fingers within, above the bottom of the sternum. Place your other hand over the first. Kneel above the victim with your shoulders over your hands and your elbows, straight and locked. Place down smoothly and evenly. Keep your fingers off the victim's ribs. Apply enough force to depress the sternum 1 to 2 inches. Press down about 80 to 100 times a minute. Count aloud, establish a rhythm. 1 and 2 and 3 and 4. After every 15 compressions, give the victim 2 rescue breaths. After you have completed 4 cycles or 15 compressions and 2 rescue breaths, check to see if the person's pulse and breathing have returned. If there is no pulse, give 2 rescue breaths and resume the compressions. Continue for 7 minutes before checking the pulse again. If there is a pulse but no breathing, give rescue breathing to a victim. A person may need CPR as a result of a heart attack. The following signs that a person have a First, make sure the person is on her back and her head is not